Hi, this video is to go over the rest of the case study. So we have Mr. Quang, and we will be finishing up his case study here. So the first question is, you are the nurse assigned to Mr. Quang. What are your best initial interventions? So this is taking place in the crisis stabilization unit in the community mental health center. So we need to make sure that we talk to him quietly, that we reduce any stimuli. We want to try to build trust. So making sure that we're following through with anything that we state. So we're trying to build some trust and rapport with him initially. And remember that we do need to address his delusions. So if he states any delusions directly, we need to clarify them of validating his perception. So it's, although you believe this, I do not. And we do that in a non-argumentative, non-judgmental way. So the next question asks, what are your most appropriate actions after he comes into the emergency room with certain symptoms? So these symptoms indicate a potential lithium toxicity. And so what we need to do is request a lithium level. Obviously, we'd be holding the next dose, and we need an EKG because lithium toxicity at this level can start to have EKG changes. We need to find out when the last dose was given, and at this point determine, along with the physician, if an emetic is needed to induce vomiting. And definitely we want this patient on seizure precautions. We want to push fluids that will just help push the lithium out of the system. The next question is, what is the rationale for the medication changes? Well, at this point, we had a very symptomatic patient who was also very, very likely lithium toxic. And so the lithium is not working for this patient at this point in time. So even though we need to stop the lithium, the patient still needs some sort of mood stabilizer. And so the mood stabilizer that they're going to try is lamotrigine or Lamictal, which is an anticonvulsant medication. And remember, that's one of our 3 categories of medications that are mood stabilizing. We have lithium, we have anticonvulsants, and we have atypical antipsychotics. The next question are, what are topics of education as he gets ready to go home? And so with this patient, we are going to be educating, of course, on adherence, and as well as early recognition of signs and symptoms. So he's going to be staying with family. We want to also make sure that the family knows that too, what those early signs and symptoms of relapse are. And then, of course, this patient is going to be on lamotrigine. So what is the important side effect that we have to educate about? It's Stevens-Johnson syndrome, or a rash. So the patient needs to go ahead and report any rash right away. And the last is a multiple choice question. The correct answer would be D. We need to get the patient away from this situation and, stay with the patient. All right. I hope that went well for you. And this wraps up all of the content associated with bipolar disorder. We will be working with a patient with bipolar disorder for virtual clinical. Thanks.